everyone, welcome back to our Literature Digest series on important allergy immunology scientific publications. Today, we'll look at the second case in this review. If you haven't seen the first one, please follow the link in the description. Let us continue today's discussion, which will focus on the systemic consequences of chronic urticaria.
Our second case study involves a 63-year-old African-American woman who had been dealing with chronic hives for about a year. And just like her first patient, nothing seemed to work for her. She had tried all the standard treatments, omalizumab, antihistamines, even prednisone, those powerful steroids. But those hives, they just wouldn't quit.
And her case is particularly interesting because it really highlights how easily we can miss important clues, especially when we're dealing with conditions that have a wide range of presentations.
So her doctors, they initially missed this potential LAI connection too.
They did, yeah. At first, they were focused on treating the most obvious symptom, which was the hives, but as her symptoms persisted, they decided to take a closer look at her spirometry results. And remember, this is a test that's often used to diagnose asthma and other lung conditions.
Right. You mentioned earlier that it can be surprisingly revealing, even though it's often overlooked.
Exactly. And in this case, it wasn't just the low numbers on the spirometry test that were important. It was the pattern of those numbers. They noticed something called reversibility after she used a bronchodilator.
Okay, so break that down for me. What is reversibility and why is it significant?
Sure. A bronchodilator, it's a medication that opens up the airways in your lungs. It's what people with asthma often use during an attack. Yeah. So reversibility, in this context, means that her lung function, it actually improves significantly after using this bronchodilator.
So her airways were constricted to begin with, even though she wasn't necessarily like wheezing or having obvious breathing difficulties.
Precisely. And that's the key here. Even if someone's initial spirometry results are within what's considered the normal range, for their age and other factors, if they have this reversibility, meaning their lung function improves a lot with a bronchodilator, that can be a strong indicator of underlying LAI.
Huh. It's like those lungs were trying to whisper a message and the bronchodilator just turned up the volume.
That's a great way to put it.
So they finally had their aha moment. They suspected LAI might be at play. What did they do next? So they were thinking LAI, right? How did they treat that? And did it end up helping her hives at all?
They went with this multi-pronged approach to really try to tackle both the LAI and those really stubborn hives. So they started her on an inhaled corticosteroid called beclomethasone.
Inhaled corticosteroids, those are pretty common for LAI, right?
Yeah, they're often the first line treatment because they deliver the medication right where it's needed, right to the lungs.
Makes sense. So she's on this inhaled corticosteroid, but what about her other meds? Was she able to ditch the prednisone, those heavy-duty steroids?
That's a great question, and it's a really important part of her story. They also started her on a medication called doxepin.
Doxepin, what's that one do?
It's interesting. It actually has both antihistamine properties, so think like a stronger version of your over-the-counter allergy meds, but it also has anti-inflammatory effects. And on top of that, they added hydroxychloroquine.
Okay, I know that one. That's often used for autoimmune conditions, right?
Exactly. It helps to kind of dampen down the overall inflammation in the body. And here's the best part. With this new approach, targeting both the hives and the suspected LAI, they were able to slowly wean her off the prednisone. And get this, without her hives flaring up.
Wow, that's huge. Prednisone can be such a lifesaver in the short term, but those side effects, especially if you have to take it long term, they can be no joke.
Oh, absolutely. The fact that she was able to stop taking it really suggests that by treating the LAI, they were getting at a root cause of those hives.
It's like they were able to finally break the cycle.
Yeah, exactly.
So she's off the prednisone, she's on this new plan for LAI. Did it actually work? Did her hives clear up?
They did. Within a week of starting the LAI treatment, her hives had significantly improved, and she just felt better overall. But, and this is important, after about 18 months of feeling great, she decided to stop using the inhaled corticosteroids on her own.
Oh no, I think I know what's coming next. Did those silent LAI symptoms sneak back in?
You got it. It's a classic case of, I'm feeling better, I must be cured. But unfortunately, it's not always that simple, especially with chronic conditions. Her symptoms came back and her lung function actually declined.
Oh, wow. That's a good reminder that we can't always see or feel LAI, even if it's causing problems.
Exactly. It could be happening in the background, even if you feel fine. And that's why that communication with your doctor is so important, especially with a condition like this.
So we've got these two very different patients, but they both had this surprising connection. Their chronic hives might have actually been linked to inflammation in their lungs.
Yeah, and what's really interesting is that both of these women, they had what doctors call recalcitrant urticaria. It basically means hives that just won't go away, even with all the usual treatments.
So really stubborn, treatment-resistant hives.
Exactly. And in both of their cases, it seems like addressing that underlying LAI, that was the key to finally getting their hives under control.
It really makes you wonder how many other cases of chronic hives or even other skin conditions are actually linked to something else going on in the body.
Right. Maybe we need to start looking beyond just the skin sometimes.
Well, this has been a fascinating deep dive. I don't know about you, but I'm definitely rethinking how I view those pesky hives.
Me too.
Yeah.
You never know what you might find when you start digging a little deeper.
As always, if you're dealing with any of the issues we've discussed today, please talk to your doctor. This deep dive is for informational purposes only, and it's definitely not a substitute for medical advice. It's just given us a lot to think about.
This is an overview of the systemic effects of chronic urticaria. This literature summary is AI-generated based on actual scientific publication in a scientific journal. This briefing conversation provides a summary of the key themes and findings. For a comprehensive understanding, please refer to the original source document. If you enjoy these topics, please like, share, and subscribe to our channel. We are Wiki Allergies. See you in the next video.